Welcome to the COVID-19 Resource Review for Post-Acute Care Facilities, Cohorting and Social Isolation. My name is Laura Reichart. I am an adult geriatric primary care nurse practitioner and the director of the Hawaii State Center for Nursing. Thank you for joining us today. I'd like to start with some disclosure information related to the continuing nursing education certificate that is available by participating in this webinar or web series. The Hawaii State Center for Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. To receive credit for this activity, participants must complete 100% of the activity, so watch the entire video, complete a post-test with a minimum score of 70%, and complete an evaluation form. The post-test and evaluation are accessible by a single link, and it is on the same document where you received the disclosure information and were able to click on the link to access this video. No conflicts of interest were found for individuals involved in the planning or delivery of this activity, and the Healthcare Association of Hawaii and its Hospital Education and Research Foundation is a joint provider of this activity, and they provided in-kind and financial support. By the end of this presentation, participants will be able to find the repository of COVID-19 resources compiled for post-acute care settings, identify what local and national COVID-19 resources are available to support post-acute care settings in delivering care, and interpret the types of COVID-19 resources by their intended use. So let's get started. Where to find the repository of COVID-19 resources compiled for post-acute care settings? Well, we have two main websites that you can access this information. The first is the Healthcare Association of Hawaii. Their website is hah.org. And the second is the Hawaii State Center for Nursing. And our website is hawaiicenterfornursing.org. Let's look at how to find these documents from a Google or your preferred web browser. I'm typing in Healthcare Association of Hawaii in the web browser, and I click on its name. From there, I can pick Healthcare Association of Hawaii, and thankfully it's the top link. From here, on the main page, you'll see that the COVID-19 resources for acute care is conveniently located front and center, and there's a downloadable document that pulls up if I click on that link. If I do the same starting steps and enter in Hawaii Center for Nursing or Hawaii State Center for Nursing in a web browser, the top hit again is the Hawaii State Center for Nursing. I'll click on that link, and you'll see two resources pretty close to the top of the page. One is COVID-19 resources, and the second is specifically for post-acute care. Let's click on the second link and open that up. Here, you'll see that the guidance document is accessible and the date that it's last updated. If I click on the post-acute care guidance document link, again, this opens up a PDF document that can be downloaded or reviewed online. Now let's identify what local and national COVID resources are available on this guidance document or resource document. On the second page of the document, you'll see that there's a table of contents, and it outlines some general sections, existing compilations of resources, communication packages, general COVID-19 trainings, limiting protected exposure to pathogens, facility preparation for COVID-19 cluster at the facility, limiting transmissions of infections, and geriatric considerations. Within these, you can also see that there are subtopics that drill down to more specific information that we are able to cluster and group together to add ease to your utilization of this resource. We always follow the same order when we listed the resources specifically. So here's an example under trainings and infographics for safe PPE or personal protective equipment practices. You'll see the top is a federal document. If there were any local resources, for instance, from the Hawaii Department of Health, we would list them next. Then you'll see professional associations. So we have the Infectious Disease Society of America. And finally, individual organizations like Nebraska Med. You can also note that the Infectious Disease Society of America is bold. And so bold items are an indication to you that it's a new update since the prior version. And this is to help you so you're not trying to figure out what's new and what have I looked at already. So what is the best practice in using this document? Well, let's consider it from the type of resources and that are included in the document and their intended use. Since we're focusing today on cohorting and social isolation of residents, there's a few topics that pop out to me. The first is existing compilations of resources. So there might be some organizations, and because of their organizational focus, they might have good resources for this topic. The second is a communication package. If we're going to be focusing on socially isolating residents, we're probably going to have to explain to them why and how to work with us in social isolation. The third is under limiting transmissions of infections, and that's the subcategory enforcing social isolation in communal living environments. And then finally, we have geriatric considerations, and specifically information for caregivers. And I identified this because we have a large number of adult residential care homes in our state, and we also have a large number of home health operations, and they can assist caregivers who are taking care of elderly or people in need of enhanced assistance in social isolation in their homes. I'm going to go over this in detail by order of priority. So let's actually look at the enforcing social isolation in communal living environments first. When we click on the enforcing social isolation in communal living environments, you can see that a large number of resources exist, specifically from the American Healthcare Association and National Center for Assisted Living. They have information on cohorting residents, guidance on communal dining, guidelines for residents' personal laundry, and when residents want to take an outing into the surrounding community during COVID-19. Though it appears that at this point in time in Hawaii, we may not have an immediate outbreak, we still want to mitigate or prevent exposure of COVID-19 in our elderly populations in particular because of their high risk. And so though some of these plans may not seem immediately necessary now, we want to continue to prevent and protect our populations, as well as plan for a potential surge in the future. There are talks about another surge being likely in the late fall and winter. And so these plans can be utilized now, but we can also work organizationally to be ready for another wave later this year. The next set of resources that I'm going to look at are for caregivers. This has information that is really supportive of in-home care, whether that be foster homes or ARCHs, adult residential care homes, and the resources behind those, if we drill down deeper and look at each of those resources, are really robust. You can see here that we have a large number of new resources from the Hawaii Department of Health, but we also have information from the Healthy Aging Foundation, the Public Health Agency of Canada, and the John A. Hartford Foundation. I want to focus on the Hawaii Department of Health. They have a large bank of information related to functional and feasible steps. So it's nice guidance if you've done the training or if you have the policy to have the materials front and center in your organization. We're all learning, this is all new to us, so we can have printable materials. And that's really what the Department of Health has identified, and they're great resources for these small communities where they may not have the opportunities to have daily or weekend check-ins from their organization. But there's opportunities for that reinforced language, both for staff, healthcare workers, and residents. Next, let's look at what the existing compilations of resources include. I want to focus on a few items here. The End of Life Nursing Education Consortium, which is the fourth from the bottom, has really good information on communication and also information on grieving. And there's different types of grief. One is grief at the end of the life, one's life, or if somebody does die during the period of time where people are social isolating. But there's also grief just from social isolating alone. And so they have some great resources to identify how to address the social and emotional wellness of patients or residents and their families, as well as staff. And then the AGS Health and Aging Foundation has great resources related to the care and treatment strategies, social distancing, and home disinfecting. Those are great resources for application, immediate application. And then the American Healthcare Association, Combating Coronavirus, Our Fight to Protect Seniors and Individuals with Disabilities in Long-Term Care, again, has some really nice resources and standard tools like letters to residents and letters to family members or caregivers to explain what's going on. And so that communication support they're really nice tools. And they also provide you that template so you're not creating something on your own. And then finally, the communication package, again, may be really supportive in this environment and planning for a future surge. In particular, I want to highlight the Asian and Pacific Islander American Health Forum. They have a list of resources. It's a Google Doc. And there you can access infographics and visuals from nearly any language you can imagine. And so if you have patients or staff, colleagues whose primary language is an Asian American, or is an Asian or a Native Hawaiian or Pacific Islander language, you can support them by having resources that it's most comfortable for them to read. If English is not their primary language, or if they're if they certainly have more comfort and ease with reading in their native language. All right, well, let's look at the resource. I'm back on the Hawaii Center for Nursing website under the Post-Acute Care COVID-19 Guidance page. And I'm going to click on the guidance document. So scrolling to the second page, as I mentioned, here's our table of contents. And I'm going to click directly on enforcing social isolation in communal living environments. It's on 2 pages, but that's okay. I'm just going to open up each of these documents so we can look at what's in them. Now, the best way to use these documents, in very few occasions are there policies that you can automatically adopt. And so the best use is to look at what's available depending on whatever you're focusing on. So today we're looking at cohorting residents and social isolation. And from there you can say, do I have a plan for that? Do I have a policy? Can I write one up? And then implement activities or implement policies and procedures from their guidance. So you can see the first document focuses on cohorting residents. It is focused in long-term care. I think it can be applied to other environments as well. But you can see that they have resources for assisted living communities as well as nursing homes. And they recommend some basic information. Assisted living communities should consider accepting less acute non-COVID-19 patients from other medical facilities in order to create more room at higher acuity facilities. So that's a best practice, or kind of a triaging of patients that you're going to accept into an organization. And also discharging patients, our residents, out of your facility if they're able to go home safely, so you can make room, and so that there is a pipeline of people who need appropriate and safe care depending on what level of care you're providing, and also ensuring safety within these different cohorts of individuals. They also recommend strategies for cohorting individuals, so creating separate wings, units, or floors, opening up non-licensed buildings or spaces, or creating alternate care sites. And do note here that they are mentioning CMS waivers. And so if you have, and you can see, I just clicked on that. So there's some guidance information that they link to. So if you are beholden to certain federal laws, they provide that information about the federal law to you in this document. And that's a really, really nice inclusion that they have. Moving down, they also focus on staff and competencies. And right after this section in the resource document is a section on staffing. So they're including how to identify new employees. Should you have a surge, you'll need more individuals than currently on staff. Also consideration of pay, competencies, and how to designate individuals. So if you have a COVID unit, you'll have a COVID team of staff. So you're not accidentally transmitting the COVID virus to non-infected individuals or staff. And certainly we want to protect staff at all times. But you're you're not incidentally transmitting it to other units by creating a bubble. This document also covers supplies and equipment. And the Healthcare Association of Hawaii does have a large undertaking related to PPE equipment. And so for local considerations, in addition to CDC strategizing or strategies for optimizing PPE and a PPE burn rate calculator, which are great tools, you can also then use those tools and communicate the needs that you may have beyond your own supply chain to the Healthcare Association of Hawaii. With space, and I think this is really important, they are recommending meal service operations being performed on dedicated units or providing meals in rooms, having dedicated rooms for staff, specific for breaks, supplies, and medication. So all of the equipment, all of the resources that are being used for COVID patients are being isolated for COVID patients. And then it has information about supports, including social support, visitors, and how to manage these resources. As I mentioned earlier, NLAC has some really nice resources on grief and communication. And so there are other support resources beyond what you see here related to specific topics. Okay. Going back, the next document is on communal dining. I really like this document for a number of reasons. One is it leads with the CMS memo related to communal dining, and they're recommending canceling communal dining and all group activities. But there's strategies to do so. And so this is what this document focuses on. So first, provide in-room meal service. Second, identify high-risk choking residents and those at risk of aspiration and creating droplets, and create special considerations for them. They should have meals in their rooms so they're not coughing in public spaces. And you should have staff with them to ensure their safety. If residents need to be brought into a common area for dining, do this in intervals. If we're considering home-based dining, perhaps it's not possible to have somebody dine in their room. So in this case, we can think about how to create intervals, and you would have asymptomatic healthy people and people with weaker immune systems eat first, and then you would have a second group of people who maybe have stronger immune systems eat second, and then finally you would have anybody with any symptoms eat last. And in between each group or each interval, all staff and all equipment should go under the necessary hygiene, so the necessary disinfecting and cleanliness measures to protect each of those cohorts or individuals. And then they do have recommendations for isolation at tables or in dining halls or dining rooms, should those meals continue. Residents who need assistance, there's guidance, so they should be spaced apart as much as possible, and staff members should perform hand hygiene, at least with hand sanitizer, each time they switch to assist one resident or another. And so again, and going back, there should be some bubbling. So So there should be direct assignments from staff and residents so that we are containing the close contact of any one group of people. And this is really nice. There's guidance on operating with limited resources. So how to utilize staff, checking in on what resources are available, including dishware, flatware, etc. Or even if we go to the last, just moving to paper products to limit exposure. So we can hand somebody a rubbish bin and they can put all of their contents in it instead of having to take a dish, put it on a cart, take it to the kitchen, sanitize it, sanitize the cart, sanitize all the doorknobs. We can limit the amount of exposure that happens between exchanges. It's a really nice document. There's guidelines for residents' personal laundry. Some highlights are that the temperature should be at least 160 degrees Fahrenheit for a minimum of 25 minutes. And for residents who are still doing their own laundering, there's a recommendation to offer laundering at no extra charge so that the facility can ensure that the linens and personal clothing or personal items are achieving that sanitation. And so when the residents are in shared areas, their clothing may not be accidentally holding on to the virus or holding on to potentially infectious pathogens without them realizing or knowing. And then finally, there's a resource on when residents want to go out into the community. And this, I think, can be really challenging, particularly if they do have a close family or caregiving community, if they are still connected to their outside community, maybe a religious organization or a club. But what we know is that there is community spread at this time, and if we look at a surge in the future, there will likely to be community spread at that time. So this really talks about how to describe the risk and how to level expectations and create a shared understanding. I thought this was a really nice inclusion. So if somebody says, oh, I'm only going to see my daughter and she's been socially isolating and I don't think I have any concerns, so I'm really just going to go out. There's a reminder here that even if you may not be exposed or the resident may not be exposed or concerned about an exposure going to see their daughter, there's still transit that's happening and there's still risk that they're taking. And even if they have perceived that risk to be negligible, there's still a chance that they can contract the virus and bring it back into the building. And that can negatively affect somebody else. So there's this leveling and layering of risk and communication that is just really nice in the way that they've processed different scenarios in this document. They've also given guidance on policies you can include. If a resident leaves, can they quarantine for 14 days? And what are the implications, or what are the actions that you as the facility need to have them adhere to? Do they have a AMA notice that they need to sign, or will you require them to wear a source control mask or a face mask? Are they able to do those things? So you can communicate, well, if you do leave, these items are going to be following you. These actions are going to follow you. Can you do that? And do you agree to that? So that's a nice resource because it can help you walk through the steps of if this, then that. And since we're here at this last document, I do want to go back actually to the top of the document and look at the communication package, because we do know that communication is really so important. So opening up this Asian and Pacific Islander Health Forum resource, we can see that we can select, if you look at the very bottom of the screen, you'll see it's on Hawaiian right now. Many of these resources were developed by the Hawaii Department of Health or the Hawaii COVID response effort. So you click on the link and you'll see this pop up on that window. You can see the Hawaii resources already contain a large number of content that's been translated to a number of different languages: Vietnamese, Chinese, Tagalog, Spanish, Samoan, Korean. So let me just click on this vertical Ilocano resource. And you can see that it is in English and Ilocano. It has images. It's reinforcing good behavior, demonstrating by both, in feet and in meters, but also pictographically, what social distancing looks like. So these are nice reminders when you're going to talk to your residents or talk to the family members about what social distancing looks like. There's also, if we go to the existing compilation of resources, so I'll click on existing compilation of resources and click on here, the American Healthcare Association. You can see here that there is specific guidance for providers, families and friends, and residents. But if we scroll down on this document, they have screening checklists for all visitors, a sample notice on restricting visitors, the same when residents want to take an outing into the surrounding community, so that document we just looked at. And there's also information on offering compassionate care and communication strategies for keeping families up to date and keeping residents engaged. So these additional resources, if we click on them, you can see that they have a number of resources if you have access to technology, individual activities, so non-social activities that may engage residents, so arts and crafts or reading. And so trying to consider how to engage and promote social wellness in this environment where we also need to engage in social isolation. They have some nice resources so that we can still have a sense of community without being physically present next to one another. So again, looking at this document, we looked at enforcing social isolation in communal environments. We looked at all of those resources. We looked at the communication package. And we looked at specific sections of the existing compilations of resources. The final section, if we click on Caregivers under Geriatric Considerations, has some nice resources, and I'll click on one of them, related to how to care for individuals at home. So these are basic reminders. Have the person stay in a separate room, avoid unnecessary visitors. And this is when someone has COVID-19 in the home. But we can also remember the recommendation that if we don't know we have it or we're asymptomatic, we can also treat and isolate ourselves as if we have it to protect those who may be at risk. So some of these activities we can still apply even if somebody doesn't have known COVID, just as a measure of social protection. If somebody does have symptoms, certainly then follow steps 2 and 3 and know all of the worsening or troubling symptoms and when to call 911. And finally, there's information on how to inform the necessary people of the COVID-19 infection. So resources like these provide a good gauge or good steps for in-home care. And then I also really liked the Health in Aging Foundation's information on social distancing and their disinfecting strategies. So because they have a very, very realistic list of what to clean and how to disinfect. So these are just nice guidance. Diluted bleach is widely accessible. If you do have, if you are using other household disinfectants, you can click on this link directly. And then how to protect yourself while disinfecting the environment. So those are the resources for cohorting and social isolation. In summary, the guidance is to reduce communal engagement as much as possible. If there is a communal environment that you cannot avoid, put bubbles around people, particularly symptomatic people. Have all the staff and all the resources that are used for those residents inside the bubble, so there's not sharing between symptomatic and asymptomatic individuals. Think about timing and spacing so you can do adequate cleaning between intervals of individuals, as well as just in general reducing the exposure from one group to another, reducing the number of close contacts any one group has. And communicate, communicate, communicate. There's so many needs to communicate right now related to why we're socially isolating, how to socially isolate, and what it means, or what are the specific activities. So we don't just say, well, we're not going to be around each other, but then we do have to ensure well-being. So seeking out communication strategies to improve our compassionate communication, also to improve the understanding, to make sure that the residents and their families or caregiving communities are well informed. Being well informed decreases the level of anxiety individuals have. and also increases compliance. And having lots of reminders around on what the best practices are, because we're all learning these steps together, and utilizing multilingual resources in as many situations as possible. So if the staff or if the residents have a primary or native language that is different than English, there are many resources available to support that reinforcement in daily practice. Thank you so much for joining me today and for reviewing the resources that we have identified specific to cohorting and social distancing within residential care communities. I also want to note that this document will be updated with regularity. And so we reviewed the resources that are up on the website as of version 2, but you may find when you access this resource that there will be updated versions. And I encourage you to look through any of the sections that are most interesting or most pertinent to you, and go through any of the documents as they most apply to your needs. If you have any questions, or if there are content areas that are missing or lacking, please do communicate that to us. You can email the Hawaii State Center for Nursing at hscfn@hawaii.edu, or the Healthcare Association of Hawaii at communications@hah.org. So please tell us what you want and tell us what you need so we can make this resource the best for you. I want to thank you for your engagement. The next steps, please be sure to take the final quiz and evaluation. These are requirements to receive continuing nursing education credits. And as a reminder, the quiz and evaluation link, which is one link, is located below the link to this video on the module page. You can also subscribe to the Hawaii State Center for Nursing newsletter for more information about upcoming events and future continuing nursing education activities. And you can register by going to bit.ly/HSCN news. Thank you so much.